My name is Dr 𝐏𝐬𝐲𝐡. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Okay, so somebody sent me this video called Understanding Psychosis, and I'd like to react to it because I think that psychosis as a mental illness and as a term is often misused and misunderstood. I've not seen this video before, so this is my first time reaction. Let's get into it. Let's see what I think. Bit of context, I've treated several hundred of patients with psychosis. Because I work with offenders, that tends to lead to violence, although obviously the vast majority of patients with mental illnesses do not commit violence.
This is Michael. He's just started college and is usually friendly and outgoing. But lately, he's not been feeling himself. When Michael leaves his room, he is convinced that strangers can hear his thoughts and are following him. He feels frightened. When Michael's alone, he is certain that he hears voices telling him that something bad is about to happen. Michael's paranoia is affecting every part of his life.
Yeah, so far this seems really accurate. So sometimes people that suffer from a psychosis have what we call a prodrome. So it's a small period of time where they're not fully psychotic, so they're not fully hearing voices or having delusions, but something seems a bit off. So they often have this underlying sense that things aren't real or that something strange is going on, or just basic paranoia. So this is a very typical kind of presentation of gradually changing.
While his friend Jasmine knows something is wrong, she isn't sure what's happening or what to do. Michael is experiencing psychosis. For most people, it is a scary and confusing experience. It can also be upsetting for those, like Jasmine, who witness a psychotic episode and don't know what is happening or how to help. Understanding psychosis and being able to recognize signs of it is the first step to not being afraid of it. And it lets you reach out and offer help to someone who may be in need. Psychosis is treatable, so getting someone help is the goal. So let's take a closer look.
Yeah, absolutely. So as I said before, I think there's a misunderstanding of what the term psychosis or psychotic means. So a lot of people assume that if somebody's psychotic, they're just kind of angry and uncontrollable and full of rage. I think it is conflated with the term psychopath, which also actually doesn't mean those things, but that's a whole different topic. Go check out my videos on psychopathy if you're interested. I'm not going to tell you what psychosis is because I assume this video is about to, but I suppose I'm just making the point that I think the term is misused a lot. In fact, I'd even argue that from my experience to the layperson in newspapers, magazines, etc., it's misused more often than it's actually used correctly. So let's see what this video is going to teach us about psychosis.
Psychosis is treatable, so getting someone help is the goal.
Sorry, I forgot to mention this. Absolutely, it's really important. So it's generally accepted by psychiatrists that the earlier you treat psychosis, the better the outcome. So if you medicate somebody earlier rather than later, the chances of them recovering quickly are higher, and the chances of them relapsing in the future is lower. Again, I hope they're not already going to say this, but I just wanted to jump in.
So let's take a closer look. What is psychosis? Psychosis is a set of symptoms that impacts a person's thoughts and behaviors. Psychosis symptoms are different for everyone, but the common experience is losing touch with reality. During a psychotic episode...
Sorry, I don't mean to be pedantic here, but it doesn't just affect your thoughts and emotions, it also affects your perception. In fact, I'd argue that it affects your perception more than other modalities, I think. But yeah, it's probably all a bit academic. Apologies.
The symptoms are different for everyone, but the common experience is losing touch with reality. During a psychotic episode, sufferers can become confused and misinterpret what is going on around them. How long the symptoms last and how intense they are varies from person to person. Psychosis can affect people of all races, ethnicities, ages, genders, and cultures.
Yeah, that's true. It can affect all of those kind of demographics, but I think it's only fair to highlight that it tends to affect some people more than others. So to be specific, it's something like schizophrenia, which is a tendency towards recurrent psychosis, which I'll be very surprised if they don't mention in this video, tends to come on in your late teens, maybe early 20s, whereas like psychosis related to dementia obviously comes on in later life. The reason why I think this is important is because probably not for the sufferer of psychosis, because if you're psychotic, it doesn't matter what age you get it, it's still an issue. But for the psychiatrist, for the doctor that needs to know how to diagnose it and how to treat it, it's important to know what is common in what age groups and what demographics.
What are the symptoms of psychosis? Hallucinations are sensory experiences that only exist in the mind. Even though Michael is convinced the voices he's hearing are real, they are actually auditory hallucinations. These are a common symptom of psychosis. Hallucinations might also be visual, which means seeing things that aren't there. People might also smell things and even feel things that no one else can. Another common...
Yeah, that's all correct. I would add to that contrary to popular belief, auditory hallucinations, so hearing voices, are by far the most common symptoms of psychosis. It's actually very, very unusual for an individual to have visual hallucinations. So generally that tends to happen in some sort of organic cause like a brain tumor or a stroke, and less so in something like schizophrenia. The reason I think it's interesting is because as a forensic psychiatrist, I work as an expert witness. And so sometimes I have to do assessments on people who claim to have been hearing voices, for example, when they commit a crime like violence. And the ones that fake it often don't know that visual hallucinations are really, really rare. So that's one of the potential telltale signs for me. So that's just interesting for me. But yeah, hallucinations, delusions are the two most barn door, obvious, important symptoms of psychosis.
Symptom is delusions. Delusions are firmly held beliefs that seem very real to the person, though they are not real. People can suffer from many different types of delusions. In Michael's case, he has the delusion that people are listening to his thoughts with the intent to harm him. And even though his friend Jasmine tries to explain to him that it can't be real, Michael is certain. Some other delusions people might experience are believing they're superhuman.
So I just want to say that's a really important point. So people with true psychosis do not have insight. So they don't know that that the voices that they're hearing or the things that they're seeing less commonly are not real. So to them, it feels really real. And the same with delusions, paranoid delusions. So the point I'm trying to make is that you can't just tell somebody it's not real. If somebody's suffering from a psychotic breakdown, you can't just tell them to pull themselves together or try and talk them out of it, because to them, the symptoms are very, very real.
Can't be real. Michael is certain. Some other delusions people might experience are believing they're superhuman or in touch with a divine force. When understanding whether a person has a delusion, it's important to consider that culture can influence how people express their feelings, thoughts, and emotions. What is an accepted belief in one culture might be considered unusual in another.
Yeah, so a couple of really good points here. So I would say that I see paranoid delusions in my patient cohort far more than any other type of delusion, simply because I deal with violence and offenders, and that, for obvious reasons, is more likely to lead to violence. So I've assessed hundreds of patients who believe that people are watching them, following them, poisoning their food, want to hurt them. Less commonly, I see people with grandiose delusions who believe that they're there for a higher purpose, or believe that they're, I don't know, like a descendant of Jesus and they have these supernatural powers. So they end up not necessarily committing violence, but doing something like really disinhibited, like, you know, running around the streets naked. And the other point is that it has to be related to their culture, or well, I'll rephrase that. For it to be a true delusion, it has to be out of keeping with their culture. So, for example, some Asian and African cultures might believe in ghosts and spirits. So somebody talking about that doesn't necessarily mean they're psychotic. It could just mean they're preoccupied. So you have to test exactly what their beliefs are, whether it's in keeping with their culture, so it's not mental illness, or whether it is something that is inexplicable and is not in keeping with their background, which could be psychosis.
Disorganized thoughts are another symptom of psychosis. Like Michael, people having a psychotic episode may make up or use words or phrases that don't make sense to anyone else. For Jasmine, Michael's behavior is becoming a little frightening. He seems confused, and sometimes Jasmine struggles to understand his muddled sentences.
Yeah, so this is actually a really interesting symptom to witness when you're doing clinical examination. It's called formal thought disorder. That's when people jump, like it's disorganized thinking, so they jump between topics in their heads, and this actually comes out in the way they speak. So if somebody has this symptom, they literally change sentences or change topics constantly, and they don't know that they're doing it. So it's quite fascinating as a symptom to witness when you're doing an assessment, because you're really struggling to keep up with their train of thought. So I don't think it was explained that well in words, but I like the cartoon kind of depiction of it.
Even if they appear distressed, many people with psychosis may not be aware of or recognize their symptoms. Others may feel that their symptoms actually have a positive impact on their lives. But for most, psychosis is a distressing and confusing experience that could...
So that's an interesting point. Can you have symptoms of psychosis that that are like add to your life or unenjoyable or pleasurable? The answer is absolutely yes, you can. I've probably had over 2,000 or 3,000 assessments or patients in my life with psychosis. And I can think of one, definitely, possibly two, where they've enjoyed hearing the voice, where it's kind of helped or it's added something to them. They find it pleasurable. It's like good company for them. Now, I think it probably happens more often, but a bit like I was saying before, these are the people that present to mental health services all need to be sectioned against their will. So it kind of is logical, isn't it? If it's something that is not causing you stress, then you're much less likely to present or even tell people that you've got these experiences. Something else that I wanted to mention that I forgot before was that there's a big difference between people saying, oh, a voice in my head is telling me to do this, and knowing that it's a voice in your head. That's not psychosis. That is either you're exaggerating something or it's like an inner monologue. But true psychosis, you don't have insights. You don't know it's a voice in your head. You think it's a real entity that's communicating with you, which is a lot more scary.
Recognize their symptoms. Others may feel that their symptoms actually have a positive impact on their lives. But for most, psychosis is a distressing and confusing experience that could be a sign of a serious medical condition. What conditions are associated with psychosis? Symptoms of psychosis.
Right, I haven't seen this video, but I'm really interested to see if it's going to be thorough, if it's just going to say the obvious barn door ones, or if it's going to go like deep and talk about the rarer ones that I would see as a psychiatrist. Let's find out.
Are associated with some serious mental illnesses. Schizophrenia typically flattens the emotional expression in people's speech, tone of voice, and body language. Schizophrenia always includes symptoms of psychosis. Bipolar disorder is characterized by unusual and extreme mood swings, which can shift rapidly from high to low and back again. At times, it can include symptoms of psychosis. Major depressive disorder causes persistent feelings of sadness, and it can sometimes include symptoms of psychosis, although it's uncommon. These are not common illnesses, but...
Okay, it's done a pretty good job so far. So just to kind of reiterate and add to what this kind lady is saying, schizophrenia is by definition, that is repeated psychosis. So if you have a seizure, that's a seizure. If you have seizures throughout your life, that's epilepsy. So in the same way, you can have one period of psychosis, that's just an episode of psychosis. But if you have a recurrent tendency towards psychosis, that is schizophrenia. Bipolar affective disorder, very briefly, is when you have like these huge changes in mood beyond mood swings. So up mania, down depression. As the lady said, psychosis doesn't happen in the majority of cases of bipolar, but if it's very severe, you can have grandiose delusions when you're manic. So feeling that you're special, you have special powers, or nihilistic delusions when you're depressed, which is also what she's talking about, depression. So severe depression, you get nihilistic delusions. So nihilistic delusions are things like, I don't exist, the world doesn't exist, I am dead, those kind of things, very negative kind of symptoms. Yeah, I don't see them often offending, aside from something like a murder-suicide.
It's uncommon. These are not common illnesses, but they are serious. And the first symptoms usually start very late in adolescence or early adulthood. Also, psychosis can sometimes be a side effect of drug and alcohol use or withdrawal. And psychosis...
Yeah, absolutely. So drug-induced psychosis, I'm sure you've heard the term. That's when somebody takes drugs, usually illicit drugs, often like skunk or speed, less commonly things like alcohol and heroin, and you can flip into this intense psychosis. I've got a video on my channel, I'll put the link in the description, about a Wu-Tang affiliated rapper who cut off his own genitals in an episode of drug-induced psychosis. Fascinating case.
This can also be triggered by medical conditions, such as a stroke, traumatic brain injury, or brain tumor or cysts.
So that's basically what I was talking about. I was wondering whether it would say those causes of psychosis, because they're so much less common and harder to spot. But yeah, I have nothing else to add. That was very thorough.
What do you do if someone is experiencing psychosis? Jasmine is very worried about Michael. Though in the past she has tried to convince him that what he is experiencing is not real, she has noticed that that approach is not helpful. She knows now that the delusions and hallucinations are very real to him, so she has learned to be careful. She avoids appearing to dismiss them or even trying to talk him out of them. Instead, Jasmine decides to talk to him about getting help. People with psychosis may not reach out for help because they may not recognize that there is a problem or may worry about being judged. But if symptoms are left unaddressed, people can experience a significant loss of daily activities, poor health, and be a risk to themselves.
Yeah, again, this is really well said. So I think the first step of somebody who recognizes psychosis in a loved one is to get them help. It almost never goes away by itself. There are exceptions like a drug-induced psychosis, but the vast majority of the times it can develop into something more serious. So I know it's possibly not what you want to hear, but my advice as a psychiatrist is you need to get that person help or yourself help. As I said earlier in this video, the quicker that you treat it, the better the prognosis, the better the outcome. I'm sure there's something else I wanted to say, but I've forgotten now. Let me go back a bit.
People with psychosis may not reach out for help because they may not recognize that there is a problem or may worry about being judged. But if symptoms are left unaddressed, people can experience a significant loss of daily activities, poor health, and be a risk to themselves.
Yeah, absolutely. So I'm not going to say anything new, but I just kind of expand on that point. Something that I see very commonly with people that are developing a psychosis like schizophrenia is this fear of presenting to professional health services. And I kind of get that, you know, I understand, because they might worry quite reasonably that it's a huge impact on their life. They could be sectioned, they could be medicated. And it's a big step, I guess. There's a stigma against mental illness, especially this kind of mental illness, as opposed to depression, for example. I mean, you know, you see all of these celebrities that have had drug and alcohol problems and depression. You don't see that many celebrities that come out and talk about psychosis. There are some, but it's not very common. And so I think there's a fear of the future. But I would argue that the potential outcome of not getting help is worse.
Jasmine approaches Michael gently, in a caring and non-judgmental manner. She communicates with him in a calm, clear way and encourages him to talk to someone he feels comfortable with, such as his doctor, mental health professional, or someone he trusts. The road to recovery may be long and hard, and it takes work, but with appropriate interventions such as medication, talk therapy, and social supports, psychosis can often be managed, and people can be supported to live full lives. You can also find help by calling, texting, or visiting 𝐏𝐬𝐲𝐝 online.
Obviously, this is the American version. If you're in the same situation listening to this video and you're based in the UK, then your GP or the NHS are the first ports of call. You can also, if you're really worried about somebody suffering from an acute psychosis, like you're worried about their safety at that moment in time, the best thing to do is to go to accident and emergency. There's always a on-call psychiatrist who can assess them. I'm going to be real with you guys. It is sometimes a bit of a painful experience in that sometimes you have to wait for several hours. And if somebody needs to go to hospital, if they need to be sectioned, then you have to call in other independent doctors to make sure that it's a fair assessment. So the whole process is long. There's not a nice way of saying that. But if somebody needs to be in hospital, you know, it's better than the alternative. Let's put it that way.
Remember, caregivers need emotional support too, and 𝐏𝐬𝐲𝐝 can be a resource. Get the help you need. Free, confidential, and available 24 hours a day, 7 days a week.
Okay, so I think that brings us to the end of the video. So just to give you some final thoughts. I thought it was a really good video. I thought it was quite gentle. I was talking about quite a harrowing experience, potentially in quite a gentle manner. I like the cartoons. I suppose my only criticisms would be that there's not really that much detail about the treatment, but then maybe that's not what this video is about. And it is complicated. It can be anything from antipsychotic medications, which themselves have problems and side effects. It could be talking therapy if it's a very mild if it's a very mild type of psychosis. I think it addressed the causes of psychosis really well, which I wasn't expecting it to. Okay, so that is my overall thoughts on this video. If you have other videos either related to mental health or criminality, because I'm kind of an expert in both of those fields, let me know in the Schmection. And I've done loads of other videos about psychosis. I'll put some links in the description so you can go check them out. And that's it. That's all from me. Peace. Have a blessed day.